Hello everyone. Today we are going to discuss another set of one-liners in relation to pediatrics. To start with, a 7-year-old boy presented to casualty with abnormal movements involving all the 4 limbs. On asking the mother, that mother tells that there has been loss of language skills in the child from 1 year and the child was having aggressive behavior at home. On doing EEG, that revealed generalized high voltage epileptiform activity. What is the diagnosis? Among these 4, we have to choose one. What are the catching point? Catching point is loss of language skill. That is most important. Second is aggressive behavior and EEG revealing your epileptiform activity. Another is the child presented with seizure at the age of 7 years. So if language, something related to language, loss of a language skill is there, the answer is very clear. The answer is LK syndrome or Landau-Kleffner syndrome. It is a rare epileptiform disorder, starts between 3 to 7 years. It is mostly related to your speech and language delay. There occurs behavioral disorder and IQ will be poor. So if someone is having seizure disorder like presentation along with loss of language, loss of speech, then LK syndrome should be brought as one of the DDs. This is the take-home message. Second, hormone that does not play a role in growth of a fetus. Is it growth hormone, insulin, thyroid, or glucocorticoid? Answer is a bit confusing, but the answer is growth hormone. This we have to remember, that growth hormone does not play any role in the growth of the fetus. Thank you. Next, a 3-week-old baby boy brought to the hospital with complaints of recurrent bouts of non-bilious vomiting. Here the vomiting is non-bilious and poor feeding for 3 days. A olive-shaped mass was palpated on child's abdomen. From this we know what is your diagnosis. Which of the following statement is false regarding this case? We know this is a case of CHPS or IHPS, but the question is, which of the following statement is false? Electrolyte abnormalities are to be corrected before surgery. Is it false or true? The definite procedure is gastrojejunostomy. Is it false or true? USG finding cervix sign is diagnostic. Is it false or true? Macrolide are implicated in the pathogenesis of this condition. Which one among these 4 is false? The answer is, as you know, this is a case of CHPS. Then the procedure of choice is Ramstead operation, and the definite procedure is not gastrojejunostomy, rather is Ramstead pyelomyotomy. This is the picture where we can get thickness of the pylorus, and what is the normal length is less than 15 mm. The muscle thickness is less than 3 mm and pyloric width is less than 7 mm. This is the normal. If you get more than this, then this is a case of CHPS, and this operation of procedure of choice is your Ramsted's pyelomyotomy. So the false is, the definite procedure gastrojejunostomy is false. Then what is one line it is written, USG finding cervix sign. How it looks like? This is just like your cervix, where you will get in USG. This is because of this thickness of the pyloric muscles. This USG finding is diagnostic of your CHPS. Next question. On trying to elicit Morris reflex, there was abduction and extension of both the arms followed by hand opening. What could be the gestational age of the child? As you know, there are 4 components: hand opening, abduction, extension, adduction, and flexion and cry. Then what should be the age of the child when the child is showing there is abduction and extension of both the arms followed by hand opening? 28 weeks, 30 weeks, 32 weeks or 34 weeks. What could be the age of the gestational age of the baby? Answer is 32 weeks. Morris reflex, 2 phases. First phase, hand opening, arms abduction and extension. Second phase, your adduction and flexion. Around 28 weeks, hand opening occur. Around 32 weeks, extension, abduction, and around 37 weeks, adduction and flexion. So the child is having only extension and abduction. So gestational age is around 32 weeks. Next, a 12-year-old boy brought to OPD complaining of tremors and poor scholarship performance. His sister has similar complaints. On examination, hepatomegaly and icterus. What is the diagnosis? Is it glutaric acidomania? It is Huntington's chorea? Is it Gaucher's or Wilson disease? I think this is a simple one. The answer is, as because the child is having something related to your CNS, something related just like your scholastic performance, tremors, and icterus, some hepatic manifestation, and similar history in the family, the answer is your Wilson's disease. As you know, there are various manifestations of Wilson's disease. It can affect your brain. CNS disease are behavioral changes, dystonia, dysarthria, salivation, dysphagia, mask-like faces, or you can get the KF ring, though it is associated with your 50% hepatic cases of manifestation of Wilson's disease and more than 90% of neurological manifestations of Wilson's disease. Similarly, you can get cardiac arrhythmia, cardiomyopathy, you can get renal tubular acidosis, you can get arthritis. In hepatic manifestation, you can get asymptomatic, simple asymptomatic hepatomegaly, even you can get jaundice, fulminant hepatic failure and cirrhosis. So here the answer is your Wilson's disease. Next, most common gene mutation in cystic fibrosis is related to. This is very much confusing. Just you remember the options are: is it phenylalanine or tryptophan? Is it the 708 position or 508 position? Or is it related to calcium channel or chloride channel? These three we have to remember. The answer is, it is phenylalanine at 508 position of chloride channel. These things we have to remember: phenylalanine at 508 position and chloride channel, delta F 508 mutation, CFTR gene, chloride channel, and thick mucoviscidosis. These are the key points which we need to remember. Next, when to stop as hypoglycemia in a SAM child? The blood glucose should be less than, is it 45, is it 54, is it 50 or 40? The answer is, though we think it is 45, it is not 45, that is in newborn, but the answer here is your 54. Next, what is Caroli syndrome? What do you mean by Caroli syndrome? Caroli syndrome is the combination of Caroli disease plus congenital hepatic fibrosis, intrahepatic dilatation plus along with that congenital hepatic fibrosis. These two when combined, it is known as Caroli syndrome. Next, curly V line are seen in which condition? Among these four, this is all are related to TFPVC. TFPVC, is it supracardiac variety or infracardiac or cardiac or mixed variety? In which case you will get curly V line? The answer is infracardiac TFPVC. Just to remember, in supracardiac TFPVC, we will get the figure of 8 appearance. Infracardiac TFPVC, where we are getting whiteout lung, and it is a medical emergency. Among these four conditions, four classes of your TFPVC, which one is one of the medical emergency? That is your infracardiac TFPVC. Next, in which condition of the mother a baby shown in the picture is born? Just look at the baby. What is this? If you know the diagnosis, then answer is bit confusing. Again confusing. The what is seen is your caudal regression syndrome. So caudal regression syndrome, in which condition of the mother you are getting diabetes mellitus. Then the next clue point, whether it is a maternal diabetes mellitus or gestational diabetes. What is it? Is pre-existing diabetes mellitus or gestational diabetes mellitus, which can cause your caudal regression syndrome? Its answer is maternal diabetes mellitus. Caudal regression syndrome is otherwise known as sirenomelia. Thank you. Please like this video, share, subscribe to my channel and share this video. Thank you.